Welcome, Dr. Andrew Dixon of Business Health. I want to talk a little bit about medications that you can use for anxiety and depression. There are a wide variety of medications that we can use. The most common, of course, are the antidepressants. When we use the term antidepressant, it's actually a misnomer. It's not a very complete description. What we should say is that these are medications which help not only with depression but also with anxiety. So we should call them antidepressant, anti-anxiety medications, but it's a bit of a mouthful. Then I want to talk briefly about medications that help to settle the symptoms of anxiety, particularly beta blockers and drugs like diazepam, Valium. Now, you may be looking at this and thinking, well, this isn't me, I'm not that bad, or I'm not the sort of person that takes medications, or actually, I don't want to take medications. That may be exactly where you end up, but bear with me and we'll just take you through the talk anyway. Do antidepressants work? Remember, we've said we're looking here not just at depression but also at anxiety. Yes, they definitely do. There's a lot of evidence that taking antidepressants brings people down from anxiety very much more quickly. It brings them up from depression very much more quickly, but only if people have really serious symptoms. If somebody's a bit fed up, a bit low, not getting on very well with their partner, or some minor difficulties at work, antidepressants are most definitely not the answer. The likelihood is that you'll get a lot of side effects and really no benefit. But if you're feeling really depressed, please look at the section on depression. If you're feeling really anxious, again, look at the session on anxiety. You will find that antidepressants help. Which antidepressant? In terms of therapeutic benefit, that is, the doing good part of antidepressants, there's really no evidence that any one antidepressant is any better than any other. For that reason, we tend to prescribe medications principally based on the bad effects that they might have, trying to minimise those. Rather than looking at a whole lot of names, I just want to look at splitting the antidepressants into two halves. One half being what we call the sedating antidepressants, the ones that make you feel rather sleepy, and the other group, the ones that don't. By far the largest group are the non-sedating antidepressants, and there are loads of them. The most commonly prescribed antidepressant in that group is probably citalopram, then there's escitalopram, there's Prozac, which is fluoxetine, there's another drug in that group called fluoxetine, venlafaxine, working in a slightly different way. Those are the non-sedating antidepressants. Now, your GP will generally prescribe a non-sedating antidepressant, and those are the ones that I definitely prefer. Of those, some people get on with one, some people get on with another. As I've said, there's no particular evidence that any one type of antidepressant is any better than the other. A study published a few years ago showed that sertraline, S-E-R-T-R-A-L-I-N-E, sertraline is probably the one that gives the fewest side effects to the smallest number of people. So if I was starting somebody on an antidepressant, on a non-sedating antidepressant, I would generally start with sertraline. But the side effect profile of all of these medications is very similar, and most of them at the doses that are generally prescribed are pretty minimal. People notice perhaps a dry mouth. They may notice that they're going to empty their bladder more frequently than before. Sometimes people feel a bit what we call dysphoric. That's just a little bit sort of out of it, as if you're sort of looking at the world through a sheet of glass. But a lot of the side effects of antidepressants are actually very similar to what we feel with depression anyway. What I've described there, feeling rather distanced from the world, it's a very typical feeling to have in depression. If you're worried about side effects, have a look at the package insert, have a look online, discuss with your GP or with your occupational health physician. Non-sedating antidepressants, though, the group we're talking about at the moment, you can generally drive with safely, you can generally use operating machinery, and you can generally use them working at height. If you're carrying out particularly safety-critical activities, however, truck driving at high speed with the emergency services, it would be very important that you discuss this either with your GP or with your occupational health service. High doses of antidepressants, I'm always rather cautious about. In my experience, you often get more side effects and actually rather little in the terms of extra benefit. So standard doses, yes. If you're taking higher doses, discuss it with your GP carefully to look at the potential benefits against the disbenefits, and preferably with your occupational health service as well. Moving to the non-sedating, I beg your pardon, the sedating antidepressants. There are many that are used there. There's two old-fashioned antidepressants which we still use, amitriptyline and duloxetine, both heavily sedating, and their plasma half-life, which is how long they stay in the blood for, a very, very long time, days. The other drug in that group, which is coming into prominence now, is a drug called mirtazapine, and that can actually make people feel very zonked for several weeks as they slowly build up the dose and become used to it. My preference generally is not to take any of the drugs in this group unless there are very, very good reasons to do so. Somebody with constant hypervigilance, constant anxiety and worry, can't sleep at all, feels as though they can't sleep at all. An example would be very severe post-traumatic stress disorder. But to be taking sedating antidepressants for simple depression with poor sleep, in my experience, most people would actually prefer to have the poor sleep and feel tired in the morning rather than have a longer period of unconsciousness due to the sedating antidepressant, but then wake up in the morning with a big chemical effect which goes on for the rest of the day. That's an opinion. It's something that you should discuss with your prescribing physician, but just to be aware of. If you're operating machinery, working at heights, driving at speed, crane operating, driving trains or any other safety critical activity, please be sure that you mention that to your doctor before you get a prescription. And if you're still in doubt, then you should discuss it with your occupational health physician. Thank you.